very much, Jill, and I'm delighted to be here. The UK strategy for rare diseases. This is a very feeble pointer, I'm afraid, so you'll just have to imagine where it's going. This is a really dull topic. I think Jill picked it because she didn't want to, wake you up too urgently on a Saturday morning. I mean, it's all about process. So I'm very sorry, but anyway, it's an important one because the UK strategy for rare diseases is the route by which services and support will be planned and commissioned for the provision of specialised healthcare for all of those who have rare diseases through the NHS, not just here in England, but in the other home nations of the United Kingdom. And it's also one of the key determinants of the research framework for the priority setting for the National Institute of Health Research, the MRC, and so on. So I'm going to be talking about a lot of process and committees and, meetings and people kind of sitting together in rooms and talking to each other. But it's important that you understand how that process is working so that as citizens, as carers, as members of a condition-specific support group, you can engage with that process and argue for the developments that you want to see in the support of the families that belong to this group in ways that the NHS can recognise and is more likely to respond to. So, prepare to be bored. Just a quick background. Rare Disease UK, there we are, there's the logo. It was set up by Genetic Alliance UK as a multi-stakeholder alliance. We have, as you see, over 1,700 members, which includes 260 patient organisations, 17 pharmaceutical companies, various professional bodies, clinicians, health professionals, and individual patients and families. Genetic Alliance UK established the Rare Disease UK campaign in 2008. It's an initiative of Genetic Alliance UK, which is the UK alliance of over 180 patient organisations that support patients and families across the spectrum of rare and genetic disease. We set up Rare Disease UK because you can only join Genetic Alliance UK if you're a patient organisation. And when we started this campaign for the development of a UK strategy for rare diseases, we didn't want to give the opportunity to the government to play off the different elements one against the other. So we thought it's important that we get all the stakeholders together and present a coherent and a consistent approach to government in order to make sure that everybody is moving in more or less the right direction at more or less the same speed and more or less the same time. And indeed, that has been quite successful. The opportunity to create a rare disease strategy came in June 2009 when the European Union adopted the Council of Ministers of the European Union adopted a recommendation that called on all member states, and it was unanimously adopted, every member state signed up to do this, that called on all member states to develop a plan or strategy for improving services and support for patients with rare diseases by the end of 2013. So we set up Rare Disease UK and we produced in 2011 this landmark document, which we called Improving Lives and Optimising Resources, which laid out the elements of a national strategy. And it talked about coordination of care. It talked about diagnosis and screening. It talked about research. It talked about information to patients, and it talked about strategic commissioning of services. So, those are the 5 things you need to get right if you are going to have a strategic and a systematic approach to responding to the needs of patients with rare diseases. Otherwise, there is a temptation on the part of commissioners to think, if you think about rare disease by rare disease by rare disease, each group is small and it's too complicated to deal with those things. So you can kind of push it aside as a series of, well, it's very sad for you, but I'm afraid it's too difficult for me to deal with. Whereas if you realize that there are over 6,000 different rare diseases affecting 1 in 17 of the population, and about 3.5 million people across the UK, which is roughly equivalent to the population of Wales. So, rare diseases are a really significant consumer of healthcare resources, and more importantly, we need to recognise that rare diseases cause a huge, huge burden on the families and the individuals who are affected, who deserve a proper strategic response from the health service and from government. So in 2011, as I say, we published the Improving Lives document, and then in November 2013, the UK strategy for rare disease was published. In December 2013, Earl Howe, the health minister, basically had to go to the Council of Ministers meeting and report on had the UK fulfilled the commitment it made back in June 2019. So getting in kind of like a fortnight early was kind of cutting it quite close to the wire, but he did it. And this UK strategy for rare diseases is actually quite a landmark document in many ways. Health is a devolved responsibility. So the NHS in England deals with health in England. It's the responsibility of the Scottish, the Welsh, and the Northern Irish administrations. And they do things differently in each of the 4 home nations. But this was the first time that all of the 4 UK governments had worked together to produce a single comprehensive strategy for providing services and support for rare disease patients. It's got 51 commitments in it, and that's an important word. Commitments, not aspirations, not, well, we will if we can, or when we get round to it. These are commitments, and they are commitments that apply across all the 4 devolved administrations. And they fall into 5 themes. Now, if you look at these themes, empowerment, diagnosis, prevention and early intervention, better coordination of care, and R&D, you will see that they actually bear a remarkable resemblance to the 5 themes that we laid out in our document 2 years previously. So clearly, there was the pressure that the campaign was able to generate had produced progress in terms of government thinking. So that was great, but a strategy in itself, it's a fine document, and in so many cases, fine documents are as far as it goes. Government could have said, here's the strategy, we fulfilled our obligation, tick that on the shelf, move on. We didn't want that to happen. So we are continuing to work with government on the effective implementation of the UK strategy across the nation. And one of the ways in which we do this is by making sure that your voice is heard in the discussions about how those 51 commitments will be translated into actions on the ground that will improve research and development, that will improve the way in which services are coordinated and organised, which will improve your ability to access information, to understand the implications of your condition, is through our patient empowerment group. This is a group of volunteer patient representatives of patient organisations. Jill, are you a member of this? Are you a member of our patient empowerment group? Yes, I thought you were. So your voice is heard in here through Jill, and that works to make sure that what the NHS thinks, what government thinks, actually is responsive to the issues that are important to you and families. We're also raising awareness through of rare diseases, through our events around Rare Disease Day, which happens at the end of February every year. And this year we had parliamentary receptions in Westminster, in Scotland, and in Cardiff. And we worked with the Northern Ireland Rare Disease Partnership on a conference that was held in Northern Ireland. And we run contact campaigns to key opinion formers. And this is one area where you can help us. You may not have noticed, but there is going to be a general election coming up quite quickly. What we want to do, and where you can help us, is to make sure that as many of the new MPs in the new Parliament have signed up to our Pledge for Patients. That Pledge for Patients calls on them to commit to supporting the continued implementation of the rare disease strategy in the new Parliament. So what we're asking everyone to do is to contact the candidates who are standing in your constituency and ask them to sign up to our Pledge for Patients on the Pledge for Patients website. So that then if they are elected, when they are elected, we can go back to them and say, you remember that pledge you signed? Well, it's time to redeem it, So, after, when you get home today, look on the internet, find out who the candidates are in your constituency, and get in touch with them and say, you will support this, won't you? You will sign up for this, won't you? You don't need to do, if it's clear, you're not going to have a monster raving loony MP or whatever, then probably you don't need to contact them. But those who stand a chance of being elected, we want to make sure that they know about the strategy and will sign up to it. We've had multiple parliamentary events. We had an all-party group chairs summit recently to launch our transition report, because one of the issues that comes up is when you pass from paediatric to adult medicine, or from adult medicine into elderly care, the services are often disjointed at those points of transition, and we want to make sure that people experience as far as possible a smooth transition from one domain of healthcare into the next. And we're following that up currently with an in-depth study on transition points. Rare Disease Day happens every year at the end of February. This year it was on the 28th of February. 29th of February is actually officially Rare Disease Day because it's a rare day. But it doesn't happen every year, so we don't want to wait 4 years. We're better than the Olympics. We can do it more often in that sense. But it's an opportunity to focus on progress and to encourage the policy dialogue. And as I say, we're running up to the general election. And one of the key things at our Westminster reception, Liz Kendall, who is the Labour Shadow Minister for Care and Older People, confirmed the commitment of the Labour Party to continuing the implementation of the rare disease strategy after the general election, as indeed did Earl Howe for the Conservatives. So we know that the two principal parties in the next Parliament are committed. And importantly, given the current political context, the Scottish Nationalist Party Shona Robertson, the Scottish Health Minister, the Cabinet Secretary for Health and Sport in the Scottish Government, has also committed to continuity with regard to the implementation of the strategy going forward. Having ministerial commitment is absolutely essential, but keeping their feet to the fire through the pressure from backbenchers is also necessary, so that they're not allowed to slide away and just let it slip down the priority list, which is why we're running the Pledge for Patience campaign. Now I'm going to talk a bit about what's going on in each of the four nations, because it's different, but it's important that we're aware of keeping the thing going. After the publication of the strategy in 2013, each of the four nations committed to launching their own national plans by the end of February last year. And indeed, England published a statement of intent, but unfortunately, immediately after they published the statement of intent, there was a change of chief executive. Simon Stevens came in, and they found that the budget for directly commissioned services in NHS England was significantly overspent. So nothing happened. They went into lockdown mode, and were running around. I think it kind of made headless chickens look like masters of strategy. But that's why it's important that we need to keep the pressure on NHS England to deliver. And indeed, in the 5-year forward view last October, Simon Stevens made reference to the UK strategy once. It was an important reference because he talked about the need to develop centres of expertise, centres of excellence. And as you are only too well aware, getting access to clinicians who understand your particular condition and can deal with it sensibly and can recognise the multifaceted nature of conditions, the fact that it isn't just a condition that affects one aspect of your lives and your bodies, but is multifaceted, is difficult. So, there needs to be that critical mass of expertise in the NHS so that you can get a diagnosis, and once you get a diagnosis, you get an integrated and comprehensive package of care delivered to you. Too often rare disease patients spend time rattling around the NHS, seeing different clinicians, having tests repeated, getting misdiagnosed, having interventions for things they haven't got, and missing out on interventions that might help for the thing they have got. When if they could be quickly and straightforwardly transited through to a centre of expertise, not only would that provide better care, it might even save the NHS some money. NHS England is stalled at the moment, and we are concerned that the financial pressure on the NHS in England is putting progress at risk. So we've been working very hard to try and make sure that key people who are responsible for commissioning are not allowed to slide away from this. But political pressure will be necessary with a small p pressure will be necessary in order to make sure that the NHS doesn't run away from its obligations and lose the momentum in a mass of bureaucracy. Now, the key person here is Fiona Marley. Fiona Marley is the new head of highly specialised commissioning, and is the person within NHS England who's responsible for delivering on the implementation strategy for the implementation plan for the rare disease strategy. Her boss is Richard Jevons. He's the Director of Specialised Commissioning for the NHS. Now, Fiona is, she's good. She wants to make a difference, but she is struggling against, she's trying to push water uphill at the moment. And, remember those names, because those are the key people within NHS England who you will need to be able to engage with in order to make sure that they are supported to do the job that they want to do and don't get sort of overwhelmed by the tidal wave of stuff coming in the other direction. We work closely with them. They're good, but they need your support in order to do the stuff that they want to do, in order to try and make sure that you get the services and support that you should legitimately be able to receive in a timely and appropriate way. In Scotland, they published this document. It's not rare to have a rare disease, in July last year, and importantly, it recognises that the delivery of the UK strategy needs collaborative working. It's not exclusively a responsibility for health. And it involves social care, it involves education, it involves academic institutions, and it involves, importantly, the contribution from industry in the framework for developing innovative therapies. It's a good document. It outlines the key objectives in relation to this, but the thing that's missing are timescales and actions. And again, we need to make sure that progress is monitored. But a good thing is that the implementation oversight group has been established and is meeting and is beginning to frame some of these clear deliverables, so we can know how far know where we are now and know how far we've gone in terms of making progress towards the desired outcomes. So that's good. We're represented on the implementation oversight group through Natalie Frankish in Scotland, our development officer in Scotland. And Natalie is always keen. Is there anyone here from Scotland? Anybody here got relatives in Scotland? Yeah, well, if your relatives want to get involved in Scotland, Natalie Frankish is your woman. And she's always keen to hear from patients and family members who are interested and able to lend support to her work there. In Wales, the draft implementation plan was published a year ago. They had a consultation which ended in May, and that got 52 responses. And this year, the implementation plan was published in February 2015. Now, this is a brilliant document. This is what really should happen when it comes to laying out a plan, because the Welsh document takes the 51 commitments, and it says, right, okay, for this commitment, this is who's responsible for delivering it, and this is when they're going to do something by. So you can hold them to account. You said you were going to do it. Did you do it? Did it work? What was the change it brought about? What are you going to do next? It's a brilliant document. I recommend it to you as an example of good practice. And importantly, too, they've set up an implementation group, but they're going to hold an annual conference, an annual event, which is open to external stakeholders, you and me, the public, to report on progress. So they will be, there'll be no hiding place for them. Now that's great. And we really must hold the Welsh Government, the NHS in Wales, to account in a constructive way. It's going to be difficult. The NHS is under huge financial pressure. There is no, wodge of cash down the back of the NHS sofa that they can pull out and throw at the problem. It will require creative thinking, it will require time, and it will require your expertise to help those the commissioners, the clinicians, think about how they can bring together the various bricks of a good that comprise a good service, and build a wall with it rather than just having a random jumble. So yeah, and in Northern Ireland, they've published a consultation document. The consultation closed in in January of this year. It was a collaborative development through the Northern Ireland Rare Disease Partnership and the Department of Health, Social Services and Public Safety. And importantly, it also incorporates cross-border working with the Republic, because obviously the population of Northern Ireland is quite small. It's only about 1.5 million people. So there's not a lot they can do on their own, but they do recognise that, collaboration with the Republic is important, but also the opportunity for patients to travel to expertise on the mainland of the UK. And they are planning to publish their response to the consultation in the summer, probably in July of this year. And that will have an implementation monitoring group set up as well. So that's the situation. Northern Ireland, it's Christine Collins at the Northern Ireland Rare Disease Partnership. So that's the situation. That's where we are now. It's not a story of, overall unalloyed triumph and huge progress and the clouds rolling back. We are not yet at the point where all patients who have a rare disease can confidently expect that the NHS will provide a timely intervention that is coherent, that is comprehensive, and that is user-friendly. However, we do have a framework in the UK strategy and in the various national plans that gives us leverage now in a way that we've never had before. So it's up to us, in a sense, as patients, as family members, as people working in support groups, to form alliances with our colleagues in the other stakeholder groups, with our clinical colleagues, with the research community, with the people who commission services, with industry, with other people who can get involved, to move forward, to keep the pressure on, and to remind the health service, to remind government that actually this is not, rare is not the same as not very many affected, therefore not very important, therefore can safely be ignored. There are 3.5 million of us, and most of us are voters. Most of us have got friends who know the situation. We can create that critical mass that will enable us to see change, see improvement, and to make sure that as we go forward into the new government, the issue of services and support, the delivery of the commitments, and remember that word, commitments, in the UK strategy is real and tangible. If we let the NHS off the hook, then nothing will change. We will still struggle to get coherent and comprehensive services. There are people within the NHS who want to do a good job. We need to work with them to help them do that and to persuade government to provide the necessary resources to enable that to happen. But it's not all about new money. A lot of it is going to be about thinking smarter, doing things better, and being more creative with the money we've got. And your insights into what works, into what can help, into what actually is probably a waste of time and should be stopped, will be important in that process, particularly when you're working in partnership with your expert clinician colleagues and putting forward a case for change to the NHS in each of the 4 home nations of the United Kingdom. So, what are you waiting for? Cheers. Thank you very much. In case you're wondering, that's the parliamentary reception in the terrace marquee of the Houses of Parliament on Rare Disease Day. And the reason I'm waving my arms around is there's Rare Disease Day is an international event. Over 80 countries celebrate Rare Disease Day, and raising your hands for rare diseases is an expression of solidarity for all of those millions and millions of patients and families around the world who live with rare diseases.